Hi, everybody. We're coming to you from West County Plastic Surgeons on Monday afternoon. I'm Dr. Tenenbaum, and we hope that all of you are going to be able to join us for this session today, kind of continuing on with our series on facial rejuvenation. So my last one, I talked about surgical face and neck lifting. And today, today we are going to lean more towards the non-surgical choices, although just one very small part of non-surgical because there's so many more things. But what we're going to focus on today is fillers and maybe a little bit of neurotoxin. So basically injection type things for facial rejuvenation. And with me today are our very talented folks.
I'm Lorraine Seifert.
They are our master injectors here in our office, and they're also here to answer any questions. So let me just first start by saying kind of generically, why do we use fillers? So fillers are injections of materials that are used to augment the soft tissues of the face. And when I say soft tissue, I mean it's soft, but it actually helps augment not only the soft tissue, but also some of the bony parts and that sort of thing. So why would we need to do that? So people sort of think like, oh, a lip augmentation to make my lips bigger or something along those lines. But the truth is, fillers or injectables can be used sort of from top to bottom, and they can fill in where we lose volume in our face. That ages us significantly. A lot of people think of like skin getting droopy as we age. Part of the reason it gets droopy is because the skin itself loses elasticity. We talked about that a little bit a couple of weeks ago. But also, you do actually lose volume in your face. So even if you've gained weight, a lot of times in your face, you don't. You actually lose weight. You lose fat, you lose muscle volume, and you actually also lose some of your bony integrity. I talked about that a couple of weeks ago as well. So what the fillers do is they help put some of that youthful volume back in your face. So to illustrate this point, look at maybe an actress or a model or just your friend who's maybe still in their 20s or 30s compared to somebody in their 50s or 60s. And what you'll see is they start to lose some volume, and compared to the young person still has a rounder, fuller face. A more youthful looking face has volume. So we can use these off-the-shelf fillers to help restore that volume and also augment some of the shape. So maybe let's start with
I'd say the cheek.
The cheek. Yeah, let's start with areas. Let's go top to bottom. So kind of the temple area. So again, look at your friends, look at yourself. You may notice that you can really see hollowing through here. You can see it on me a little bit. See, Maria's time.
It's not something that most people recognize, but just a little bit of filler to bring it back out is very feminine, and it makes a big difference.
Absolutely. And what we have here anatomically, you have muscle and you also have a fat pad. It's your temporalis muscle. So you clench your teeth, you can feel a muscle moving there, and you can feel how the bone is a hollow. And so as the muscle and as that fat pad starts to get smaller, you see the bony outline of this bone and your cheekbone, and that starts to indent. So we subtly fill that back out, and it can make a really nice subtle improvement in just that overall volumizing of the face. Cheek. Who loves cheeks?
I love doing that.
Yeah, everybody loves cheeks. It's probably one of the most powerful places in the face to put filler, and it should look, if you're going to somebody experienced, it should look very, very natural. But go ahead.
The thing that I love about it is as we get older, we get jowls. And what a lot of people don't realize is our bony structure up here is what holds this up. So by taking care of rebuilding that area, the jowls
Absolutely.
are much better.
Absolutely. So the cheek lifts the face. So especially with some of the newer fillers, it's not just simply puffing the cheeks. It's truly lifting the lower part of your face. So a lot of people come in because they start to notice this area. They say, I'm getting creases here. We want to start filling here. That's actually a pretty old-fashioned thing to do. We try not to simply fill there. That's how you get kind of that cat face look. And when you see people and you go, ooh, she's got filler, it's usually something along those lines. So If you fill the cheek, you notice that this already softens and smooths. If you kind of revolumize here, that's what's causing that crease, is a drooping of the cheek. So if we can lift that cheek, this softens, and as Lorraine mentioned, the jowl can soften too.
Your under eye also, a lot of people don't realize it also brings up the under eye. And patients report when they come back, they feel like they don't look as sad and they look brighter.
Absolutely.
But it doesn't look like, they don't look like they have filler, and that's what's so nice about it.
Especially treating the apex, it's lifting, because I know as we age, we definitely get more hollowing there.
Yeah, absolutely. So cheeks are a must on almost anyone. That's really a great place to put filler. And a lot of the fillers that we use nowadays that can go in the cheek can last quite a long time. And we'll get to different types of filler in a little bit. I don't want to be too scatterbrained.
I see we have a question of what
age do people?
typically?
So I started in my 20s, which may sound crazy. I started in my late 20s. Very, very, very conservatively in my late 20s. Now that I'm in my mid 40s, I do it a lot more frequently. In my 20s and 30s, I would say I did it maybe once a year tops, and depending on the place. So for example, the under eye hollows, I think a lot of people actually do start to get those in their 20s. And so a very conservative fill in the under eye hollow can be extremely effective. And especially if you're really young when you start that, you really don't need it very frequently. And then of course the cheek, again, almost everyone can use that.
I think people are more and more preventative than
Correct.
anything.
Correct.
So.
And fillers can be preventative as well. So we went cheek, but tear trough under the eye, and even some upper eye. Again, if you look at photographs of more elderly folks versus younger folks, the eye is very full in a younger patient, as opposed to people thinking like, oh, it's just drooping, so pull everything back. That's actually not the way to really rejuvenate the entire orbital area. You want to add back some volume because people lose volume, and so fillers can be used to do that as well. Jaw lines are becoming a lot more popular. So again,
It's a very youthful look.
exactly. So you have this angle of your jaw when you're younger. It's a little crisper, a little sharper angle. As we age, again, the muscle here starts to atrophy, and the bone of the jaw starts to atrophy a little bit too. So kind of filling that back out in men and in women can give you a nicer angle here that looks more youthful.
And it also can really kind of, even though you're not directly treating the neck, but when you bring back that definition and really, youthful look for that, people feel like their neck actually looks better.
And it does.
And I think you brought up something too, men. We're seeing increasing numbers of male patients because males want to look younger as well. So
Yeah, and you don't have to look feminine.
no, not at all.
Going to injectors that are really experienced is really helpful because you want to make sure that your injector
That's the
treats a
difference
lot of men, because you don't, it's same thing with your surgeon. I do a lot of male faces and eyes, and the last thing we want to do is feminize the face. We want to just roll it back a few years.
And I think you have to know the products. Like we use not necessarily different products, but we put heavier products in males because their face can handle it, and it gives it a more masculine feel. Where if you're just using the normal things for females on males, it's not going to give them the results.
They have a heavier face. It's a little more oomph. So of course, we can augment the lips, and again, that's going to be your own personal aesthetic, but I would say that in our office, we favor, again, a more natural, more youthful mouth rather than a mouth that looks injected. And so we're using it because as we age, our lips thin, we lose collagen in the skin and the mucosa of the lips. So we're trying to plump and hydrate that lip again, also help treating some of the fine lines that can form around the mouth. That's what we're doing it for. Everybody knows you can augment those lips as much as you want. That's not really what we're advocating. We're advocating more of a rejuvenation of the mouth complex and not doing it out of balance. The chin, the nasolabial folds, the area right here, Lorraine mentioned a jowl. As this starts to kind of droop or drop here, sometimes filling the cheek helps bring that up, but then also sometimes filling in front of it so that you again get that nice straight line. So fillers can really be used from top to bottom, and it's really important to have a facial analysis done. So you, again, a patient may come in, or you may come in and go, okay, well, what is bothering me are these lines here. And that's kind of what you're focusing on. But a skilled practitioner is going to be able to look at your entire face and really look at what is aging you and what is causing those lines. And so the recommendation may be to treat a couple of different areas to help bring that into harmony. Again, if we simply treat it here, for example, it's going to look unbalanced a lot of the time. Or somebody who just gets their lips done and doesn't have kind of the whole oral complex kind of addressed and treated, it can look very out of place, and that's when it does not look natural.
And I would say too, I think there's a misconception, especially with filler of the lips and everything, with people, that really there's a lot of people out there, because you assume you know anybody who had lip to the filler because you've seen the ones that have been a little over accentuated. But a lot of people who have filler to the lip, nobody knows, because we've just replaced what they used to have.
Absolutely.
So I think there's a misconception about that. I would also say, you know, over the 10 years I've been injecting, the variety of fillers and what's available to us now, and understanding where the source has really evolved fillers, and going to an injector that has a variety of filler and not just more of one or two, because they all kind of have their niche, but they all work in different ways, and you need that variety, I think, to get the best result.
Yeah. And I would also put another plug in for going somewhere that is not simply an injection clinic. Obviously, I do injections as well, but I have very skilled a nurse practitioner and a PA who does an excellent job with injections. But I think that the difference with our office, as opposed to going to a PA or somewhere who's just off on her own, is that you really have that marriage with a board certified plastic surgeon, because a lot of times there's some overlap between non-surgical and surgical. In fact, I would say almost always, almost all of my face and neck lift patients are seeing them as well for skincare, for skin treatments, for volume, for all kinds of things, especially maintenance over time. And so you want somebody who's willing to share you, as long as they feel it's what's going to meet your needs and what's best. So it's very common for Emily to say, hey, come look at this patient of mine. I think she needs a neck lift rather than an old therapy with me. What do you think? And so we're definitely going to do what we think is best for you and is going to be your best ultimate result. And I think that's really, really important for you to seek out, is kind of that combination with a highly trained surgeon along with your injectors.
And I think too, with being Washington University, they focus on continuing education. So the amount of continuing education that we get is a lot more than most places.
Absolutely. Absolutely.
I also tell our patients a lot too, there's not one thing out there, including surgery, that addresses all aspects of aging.
No.
So to really get the best result, it's a combination of stuff, and that's what makes you look the most natural and looks like you.
Yeah, natural over time, and it's often sort of a long-term sort of plan, just like you go get your hair done.
Yeah.
Whatever. I mean, maybe it's less frequent than your hair, depending on how many grays you have. But it is like that ongoing maintenance of you don't want your whole face blown up one time and then you're good for 5 years potentially. You want to maintain it over time so it continues to look natural, continues to look like you, just a more well-rested version. But you started to, let's segue into kind of some of the different types of fillers. So as Emily mentioned, there has been such great advancements in the technology of what we're able to inject. We really have tried just about everything that's out there. And of course, just like anybody would, we sort of cultivate and curate our favorites, which is still a lot, because again, it's not one size fits all. So as far as different types of fillers, the most common types of fillers that are out there are a plethora of what is called hyaluronic acids. So you've probably heard that term. There are a couple of different brand names that are hyaluronic acid. But what has evolved over the last several years is the way the particle size. So think of the filler in terms of thickness and size, and all of that goes into how much volume it gives you versus smoothing, how much lift it gives you versus filling, and how long they last. It's up to us to know kind of how to use that in your face. But suffice it to say that there's great technology, that we have longer lasting fillers, and it's not going to be one size fits all. We're not going to use the exact same filler in your tear trough, in your cheek, in your fold, and in your lip. It's probably going to be a combination of at least 2, if not 3 different types of fillers for those different areas that are going to give you the most optimal result for that area. We don't want to use the wrong filler in the wrong place. And that is, again, sort of up to us. But that's a really, really cool advancement that we've had in the last the last handful of years. There are some different chemical fillers as well that last a bit longer, that can be used deeper in the face. And then there are some that are designed more to sort of stimulate and build your own collagen. And exactly. So we inject those, kind of see the results, and then the filler itself goes away a bit, but in its place, it lays down some of your collagen. What else do you want to say about that?
I just think it's so much better than it used to be, and I think the way we address it and what's available to us, they even also made them now that it really is, a lot of them cut down on swelling.
Yeah.
So even for the first couple of days, that inflammation and the swelling and bruising, which is the most common side effect of fillers, have actually improved a lot. So people are more likely to, not to have much downtime and go about their business, and that's always a plus.
Yeah,
And
absolutely.
some of the new ones are also the tri-link or cross-link fillers, so they move more naturally with your face. So again, it's a more natural look, and you get more longevity
out of them as well. So that's great. Let's use that to segue into what you can expect. So again, depending on the area, depending on your individual anatomies and so forth, the most common side effects are bruising or swelling. I would say, depending on the area that you're filling, the vast majority of people don't actually get bruising. We always warn you that you could get some bruising. You certainly wouldn't want to have fillers a day or 2 before you had a big event or needed to be photographed. But the vast majority of places we fill and people we fill, there really isn't a whole lot of bruising. There can be a little bit of swelling. The areas that tend to swell, lips tend to swell just because they're a really sensitive, very vascular area. So it's not the filler itself as much in that area as it is just your anatomy. It swells a bit more. The fillers, though, themselves take on water. So hyaluronic acid is naturally found in cells in your body, and it's a hydrator. So you've probably also heard of hyaluronic acid in your skincare, and that's because it's a hydrator. And so when you inject it, it is going to take on some of your own water and swell a little bit. But as Lorraine mentioned, the newer technologies, they don't take on as much of your internal water, and you don't swell as much. But certainly those are the most common side effects. Other things to be mindful of is we're going to take your photographs, and it's nice for you to actually look at your own photograph as well, because everybody's face is highly asymmetric. So you can look at all of us right now. We're all asymmetric, and that's normal. Fillers can help camouflage that, but it's never going to completely take it away. And so sometimes you don't notice that until you actually look at a photograph of yourself with a practitioner and kind of go through and say, okay, I think we can make this asymmetry better, but we're never going to erase it. And so kind of being aware of those types of things ahead of time is really important. What else? Very rarely things like allergic reactions. I mean, we just barely ever see those kinds of things. And we also very rarely would see something like an infection. There are some very devastating side effects that can happen, such as injecting into an artery, which can cause loss of blood flow to a certain area of the face. And that actually can be, that's one of like the dreaded complications of fillers. It's more common within certain types of injections or certain anatomical regions. This could be a whole different segment, so I'm not going to go into it too much today, but like non-surgical rhinoplasty, for example, injecting the nose to help camouflage certain areas of the nose, such like you would do in a rhinoplasty. That's a really advanced move. So again, you don't want to go to just anybody. You want to go to somebody who really knows that anatomy, knows exactly where those blood vessels are, etc. So again, thankfully that's very, very rare, but those are the things you should be aware of.
And knowing how, if it ever does happen, how to fix it.
Yes, absolutely. How to treat it. So yeah. Fillers are up for almost everyone.
Mm-hmm.
It's the
So-
bottom line. Almost
Okay.
everyone can benefit from some filler.
So if anybody hasn't had experience with filler and would like to come in, we have our event on November 14th. From
Yes, so
3:30
next Wednesday.
Yeah,
Yes.
3:30 to 5:30. There'll be live demonstrations. Oh, I'm being told
Till 7.
3:30 to 7.
Oh, 3:30 and 5:30.
You don't have to be there the whole
Yeah.
time, but it'll be great because we'll have great, more in-depth education about the stuff that the three of us just talked about today. More in-depth education on all the different types of fillers, a little show and tell, exactly what those fillers look like, what they do, some live demonstrations. And we'd love it if you'd RSVP, call our office, or you can even respond on our Facebook page here, and we will get you signed up. We will also be talking quite a bit that evening about skincare, specifically with one of our most favorite brands, Elastin Skincare, which we love for everyday skincare, but we also have some Elastin products that really help pre and post treatments, like fillers, like lasers, like peels, all those sorts of things. So our Elastin, we are very lucky in our office that one of the Elastin ambassadors happens to be our esthetician, Jen, who many of you know and love. She's fantastic. And the reason she's an ambassador is because she has had such extensive training on this product and really knows her stuff. And so they will all be there as well talking to you about skincare.
And it's not just the face. They have a really great neck cream. I mean, the results I've seen in my mother are amazing. So, it's not even all procedures, just really good skincare.
Absolutely. Absolutely. So if you guys have any more questions, feel free to message them in, and I'll try to answer them maybe at a later Facebook Live. But this was really fun. I like having little partners here to do it with me.
It's
Super fun. So yeah, thanks everybody, and have a good rest of your day. Oh, if you want to call to RSVP to the event, 314-996-8800 and press 2, and just say you'd like to RSVP for the filler and freeze party.
And we'd be happy to answer any questions.
Okay, thanks guys. Have a good rest of your day.
Bye.
Okay, good. You guys did great.
Wonderful.